One of the topics that's like a hot topic now, I couldn't make this presentation without talking about it because everyone again is trying to find like the solution to making physicians' lives and nurses' lives easier. These are the milestones that have been occurring in the past, I'd say like year or so. So in October 2023, President Biden, he signed an executive order. There's the very long name there, as you can read. And then in May, there was a roadmap for artificial intelligence policy in the U.S. Senate, was developed by an AI work group because there was concerns of ethics being involved. Like, where is that data being queried from? Where is it? How is it gathering this information and then provide this output to me so I can see it? And then more recently, within this year as well, Governor Jared Polis signed a state law regulating use of AI in the private sector. And this is including healthcare, which is huge because it sets a precedent for other states to now get involved and ride on that bandwagon, if you will, with artificial intelligence. Specific to Epic, so these two bodies met. So UW Health was one of the original Epic customers because Epic is based in Verona, Wisconsin. So they teamed up. They went to Washington, D.C. on June 5th of this year, and they focused on AI through the perspective of healthcare delivery and the patient provider experience. So, like, what does that really mean? It's like a big topic, right? So the themes they focused on were AI's potential, like what can it actually do in healthcare to make our life easier? How can we actually utilize it? Um, Workforce shortage was one of them. A critical need for transparency as I reaches the point of care too. So what that is really getting to is how is AI going to interact with the patient? That's how I read that sentence. So how I see it today is it's used in the in baskets, it's used in patient portals. It's being piloted in organizations right now. And that's how they're trying to make it better for staff. And obviously messages can be edited, but it gathers a really good, synopsis of what's going on with the patient in their chart in that recent message and generates some data. And then the real important piece too is what this is like AI is such a broad topic, but you need to take in like the local atmosphere to ensure like the efficacy across a diverse patient group. Because like if you look, for example, like I'm in Detroit, it's a very diverse population, right? But if you go to like California or Florida, then you're reaching different types of people, different backgrounds. So you have to think about, how efficient is this for our patients that we see today? Is it going to work for us? And then if not, how can we make it work for us? Epic is using these following things with their customers. And this is all widely available. This is on the web. This is not like secret information. So they're generating in-basket messages to my chart messages today. They're writing visit notes based on the conversation during the office visit with something called ambient voice technology. So this is kind of cool. So they might be logged into Epic, but then the AI is collecting all the information and writes a note for them at the end of the conversation and puts it in a note. So the doctor doesn't have to write the note and spend 30 to 45 minutes or longer writing one note. It's already pre-populated. It's up there on their screen for them, and they just have to validate and edit and then sign it. Another one is looking at like dashboards for key takeaways. So it searches the patient's chart. So this is kind of neat too. So Epic does have like a search functionality within the patient's chart today, but this is actually making it like a smarter search is my interpretation. Kind of like a Google search, if you will. It's a good way to think about it. And then we can also look at the next piece here, summarizing recent notes before a visit, which I think is critically important, especially if you're a provider who've not seen that patient before. Maybe it's a new patient. It's good to know what's the story, what's going on with them. Were they hospitalized? Maybe this is a mom who hasn't had any prenatal care and it's month 6 and they show up to the clinic, right?
So John, we have two questions came in. This slide
Yeah.
triggered a lot of thought. First question is, are you going to be able to make the slides available to the attendees?
Yeah. Just let me know, Teresa, do you want me to send it to you?
Yeah, if you make it
Yeah.
pre-sufficient. Second question is, do the notes that are collected via ambient technology also create a workflow? For example, can they prep a test order?
I think that's their plan. I haven't seen them do that yet. Right now, they're trying to work on the note specifically, but I don't know if it's smart enough yet to listen to the conversation and be like, okay, order a CMP, BMP, and all these different things. I don't know if it's smart enough to do that yet.
Okay,
Um, were there any other questions before I move
just
on?
those two. Sorry, those great
Yeah,
answers. Thank you.
yeah, no problem. Um, and then this is an interesting one too. And some of these features, I think this bottom one might be a work in progress still. So they're extracting the follow-ups for imaging reports. Um, and I think part of that too is actually probably reading the imaging study and saying like, is this an abnormal result? Um, Trying to go through that information and what is the follow-up. And I don't think they're going as far as that as like interpreting the image. That's why we have radiologists. But I think if I was to be like a futurist, if you will, that's probably where they're going to go down the road is the interpretation of those things. So just some things to think about as we're going through this.